And joining us now to discuss the fight against COVID in China is Hu Naijun. He's an associate professor in the School of Public Policy and Management at the University of the Chinese Academy of Sciences. Good morning to you, Professor.
Good morning.
Hi there. So in your estimation, how is the healthcare system coping with the current wave of COVID cases in China?
Well, I think, in my opinion, the most important thing is how to shift resources, including human resources, medicine resources, and other information guidelines to the grassroots level. That is, for example, in rural area, the village, and in urban area, the community. Because right now, I think the capacity of our hospitals must be very crowded. So I think we must make sure that our grassroots level, I mean the community level and the village level can work, can deliver basic fundamental healthcare services, can give guidelines for the common people how to use medicines and to give them medicines directly, etc., etc. So I think right now what we are doing urgently is to shift the focus, the resources to the grassroots level.
And I'm glad you brought up, Professor, the subject of rural areas, because most of the outbreaks until now have really centered on city centers, urban centers. And as we saw in that report, doctors and hospitals in rural areas are now preparing. How big is a threat of a surge in rural cases?
Well, I think if you look back into the history of China's development, you can see the quick process of urbanization. That is to say, the younger generations and the young people intend to work and live in the city, and they will return home, I mean the rural area, during Spring Festival holidays. So that is why we are facing a threat and a challenge right now, because Spring Festival holiday is around the corner, and a lot of young people will come back home to their rural areas. So I think that means the threat and the challenge to our rural area. But I think right now, if we shift resources to the grassroots level, I mean the village level, I mean, for example, every family, etc., etc., I think we can be prepared for this transfer. And when the young people get back home in the rural areas, they will meet, I think, a fundamental healthcare service in their home, whether in rural area or in urban areas.
Right. And we are looking at the first Spring Festival since the pandemic began, where restrictions are lifted. How do you think this will affect celebrations this year?
Well, I think after 3 years of prevention and control of COVID-19, people are looking forward to their family reunions. But I think right now it is the individual, everyone should shoulder the responsibility. So I think although we can't go back home without any quarantine or other measures or policies, we still have to keep it in mind that we still have to wear a mask in public places, we still have to wash hands when we come home, and we still have to keep social distance, etc., etc., especially to protect our vulnerable people or member in the family, for example, the older or the children. So I think everyone should be cautious about this Spring Festival, and we are still have to fight against the COVID virus, but this time I think the responsibility will rest more on the shoulders of every common people.
A very important message indeed. Professor, we have just about 30 seconds left. Now that China says the COVID situation is under control, what's next? When will life feel fully back to normal in China?
Well, I think right now it is not the virus issue on how long we will be back to normal. I think right now is when shall we be fully prepared? That means our hospital systems, our hierarchy of healthcare services systems, our grassroots healthcare services. If all these healthcare services facilities are ready, then we can say we will be back to normal. But in my opinion, I think there are probabilities of everything. For example, the possible new variants of the COVID. So I think in the near future, we still have to be cautious. When we forget to ask how long do we have to be before we get to be back in normal, I think it is the time for us to be back in normal.